What is Xarelto used for? Xarelto, also known by its generic name rivaroxaban, is a medication that belongs to a class of drugs known as direct oral anticoagulants (DOACs). It is used to prevent and treat blood clots that can occur in different parts of the body. One of the primary uses of Xarelto is to prevent blood clots from forming in the legs and lungs of individuals who are at a high risk of developing these types of clots. This may include individuals who have recently had major surgery, such as knee or hip replacement surgery, or those who have a history of deep vein thrombosis, DVT, or pulmonary embolism, PE. Xarelto is also used to treat DVT and PE once they have occurred. By preventing the formation of new clots, Xarelto can help to reduce the risk of serious complications such as lung damage and death. It is also used to prevent blood clots from forming in the legs and lungs of people who have an irregular heartbeat, atrial fibrillation, that is not caused by a heart valve problem. Additionally, Xarelto is also used to prevent blood clots from forming in the legs and lungs of people who are recovering from a heart attack or stroke. This medication can help to reduce the risk of these individuals experiencing another cardiac event in the future. It's important to note that Xarelto can cause serious bleeding and hence it should be used with caution, especially in people who are at a higher risk of bleeding, such as people with a history of bleeding disorders or those who take other medications that increase the risk of bleeding. It's also important that individuals taking Xarelto have regular blood tests to monitor their clotting time and make sure the medication is working effectively. Overall, Xarelto is a powerful medication that can be highly effective in preventing and treating blood clots. However, it should be used only under the guidance of a qualified healthcare professional, and it should be used judiciously to avoid the development of any serious bleeding.